Hello, everyone. I'm Victoria Delgado from the Leiden University Medical Center, although right now I'm at EACVI, the Best of Imaging 2020 in Barcelona, although this is a virtual background. I'm very happy that you join us in this symposium sponsored by Medis, where we will speak about the state of the art on the strain imaging in 2020. For this, we will have excellent speakers that will provide their view on the use of the different techniques to evaluate myocardial strain. What is strain? What is myocardial strain? That is the first thing we need to have clear. Basically, strain is just deformation of the myocardium. And here on the slide, we can have an original length, and the myocardium can thicken, so it makes larger, or shorten. And this deformation is what we call strain. We can also have a strain rate. And strain rate is the velocity or the speed that myocardial deformation occurs. So if we have two patients, as you can see here, patient V1 and patient V2, both of them reach the same amount of thickening. But patient V1 acquires the thickening magnitude much faster. That has an advantage because the amount of deformation that we can get depends very much on the heart rate. And if we have very high heart rate, the patient number one is going to reach the same amount of deformation in a much shorter time, while the patient number two may have difficulties to reach that same deformation. So strain is the total amount of thickening or shortening the patient can show, and strain rate, the velocity at which that deformation occurs. And if we think that a myocardium is a three-dimensional structure, and we know which is the anatomy of the left ventricular myocardium, where we have two different layers of myocardial fibers oriented in a different way. In the subendocardium, we have a right-handed helix orientation, while in the epicardium, we have a left-handed helix epicardium. We will understand that the myocardium shortens in the longitudinal direction, shortens as well in the circumferential direction, and from both shortenings in the left-handed right helix and in the right-handed oriented helix, we will have a thickening in the radial direction. We can measure all these deformations with echocardiography. We can also measure with feature tracking magnetic resonance, and most recently there have been developments that can measure the myocardial deformation on computed tomography data. If you want to know more on what are the clinical applications of these new imaging techniques and how do we use in clinical practice strain imaging, please join us to the different symposiums, to the different workshops presented by myself for the part of echocardiography, presented by Sebastian Kelle for the CMR feature tracking, and presented by Joao Cavalcante for the CT feature tracking workshop. Please join us and get used to measure and to use in clinical practice strain imaging. Thank you very much for your attention, and I hope you like them.